Also tonight, Johnson City Police charged a nurse with attempted credit card fraud and identity theft after allegedly stealing from a hospital patient.
That patient reported more than $1,000 in fraudulent charges earlier this month. An affidavit states the name connected to the transactions came back as Charlotte Nanka, who was a nurse at Johnson City Medical Center at the time.
Police say she wrote a confession to the crimes. Now the family of the affected patient is demanding answers as to how this was allowed to happen. News Channel 11's Jayana Scurry spoke with the family about their concerns. Jayana?
Sarah, Casey, I spoke to the victim granddaughter, Kyra Bullock, who says as a nurse herself, this situation blows her mind and taking from a patient is something she would never think to do. Wilma West was hospitalized at the Johnson City Medical Center fighting fibrosis, blood clots, COVID, and pneumonia all at the same time. And that's when she got a call from Northeast Tennessee Credit Union about strange charges on her card. Kyra Bullock, West's granddaughter, was able to find where the charges came from.
Got in contact with American Eagle and was able to get the transaction, which had the card used as Wilma West, which is my grandmother, and then the shipping address had Charlotte's name on it. Charlotte Nanka, a nurse at the Johnson City Medical Center, had used West's card to purchase over $1,000 worth of items. Has since been fired, arrested, and charged with attempted credit card fraud and identity theft. Just last year, Nanka's nursing license was suspended in Vermont for using a patient's checkbook to write herself a check for $1,200, according to the National Council of State Boards of Nursing. The records were not made public until December. Ballard hired Nanka in September. It's hard to believe that you can go from one state to another and just not have that carryover with you. It's like, how are you still practicing with your nursing license after you've done this before? We reached out to the Tennessee Department of Health about why Nanka was able to practice in the state. The department could not provide additional details, citing a Tennessee code that keeps this confidential until formal charges are filed. Bullock advises family members of those who have loved ones in medical facilities to take their valuable items home. I feel like I could have probably taken her purse and debit card and stuff. So I think people just need to be more aware of that. It's difficult in the moment though, because you think that you can trust like nursing professionals to take care of your loved one. West was diagnosed with fibrosis last year and given 6 months to a year to live. It's already hard enough to like deal with losing someone and knowing you're gonna lose them, but then to have to go through something like this on top of it, it's like you're not taking just money away from a patient, you're taking literally precious time and some of our last moments together. West was released from the Johnson City Medical Center today. She's been refunded her money from American Eagle, but still is waiting to get the rest of the fraudulent funds back. Casey.
Thank you, Jayana. Ballad Health sent out a statement in response to the allegations. The company says in part, quote, theft from a patient is unacceptable and a complete violation of trust. The individual team member who acted alone is no longer employed by Johnson City Medical Center, and Johnson City Medical Center is cooperating with law enforcement. Johnson City Medical Center intends to pursue all legal options, including reporting the matter to the individual's professional regulatory board, end quote.